Hello there. So first and foremost, I want to thank you for the opportunity to meet with all of you and share information about CalOptima and Medi-Cal. I do recognize that insurance is extremely confusing. So my goal today is really to provide you with an overview of who is CalOptima, Medi-Cal programs and services, as well as support services, and share information about our behavioral health services, so that you have a better understanding of the Medi-Cal benefits that are available to our members. So with that, I do like to start with a sort of a high-level overview, so that we're all sort of on the same sort of starting point as we talk about health insurance. So first and foremost, we hear the term Medicaid, right? We heard it quite a bit in this last election. And Medicaid is the federally and state-funded health insurance plan, primarily based on income eligibility. Now, with that said, certainly it's focused on serving individuals who are seniors, people with disabilities, children and families, and specific medical conditions, which I will share with you. Now, this is the term that is used across the nation. It's Medicaid. It's the state and federally funded health insurance plan. In California, we like to be different, so we call it Medi-Cal. So essentially, Medi-Cal is the same thing as Medicaid, and it's in the state of California. We call it Medi-Cal. And when you look across the state, you know, Medi-Cal does look a little bit differently when you look at the counties. For example, in LA, there are two health plans. It's LA Care and Health Net. In Riverside, we have Inland Empire Health Plan in Molina. San Diego, there's 6 plans to choose from. In Orange County, there's 1 plan. It's Medi-Cal, and CalOptima administers the Medi-Cal benefit to Orange County residents. Another term I wanted to share is the term of managed care. And you probably have heard that quite a bit. It's almost like a bad word, right? Managed care. And so the way I like to describe it is the way that health insurance is delivered. So if you start employment, if you're working 30 hours or more, your employer will offer you health insurance, and there are different types of plans. So the PPO plan, as many of you may know, this is when you can select any doctor or specialist under the health network, and it doesn't require referral, right? You're able to see doctors or specialists so long as they're under the health network without a referral. That's a PPO plan. The other plan is an HMO plan, where oftentimes you will select a health network and a doctor under that health network, and everything starts with that primary care physician, and we'll just call PCP, or doctor for short. So that doctor will refer you to see a specialist for ancillary services and whatnot. So that is an HMO plan. So CalOptima, we are a managed care plan, and essentially it's the PCP, or the doctor, that manages our members' health. And so we are more similar to an HMO plan. So I wanted to kind of start with that as sort of a basis for the conversation that we'll have today. Now, CalOptima, we are Orange County's community health plan for low-income families, seniors, and people with disabilities. We are the largest health plan in Orange County, serving 1 in 4 adults and 1 in 3 children. And we've also been recognized as the leading Medi-Cal plan in the state of California for 6 years in a row. With that said, I think there's still a lot of confusion in terms of who CalOptima is. In non-COVID times, my team would be out in the community attending about 130 health and resource fairs. And oftentimes we will engage with our members, and our members recognize that they have Medi-Cal. However, when we ask them about CalOptima, you sort of get this sort of glaze or this blank stare. And so what we recognize is that a lot of our members know that they have Medi-Cal, but they're not necessarily familiar with CalOptima as the entity who is administering the Medi-Cal benefits. So if they have questions, if they have concerns, if they want to know and learn more about their benefits, they may not know who to call. So my goal today is really to help bridge that gap. So if we have members who have Medi-Cal in Orange County, and if they have any questions or concerns, we want to encourage our members to call us so that we can answer their questions and also increase their access to their healthcare benefits. Our mission is to provide our members with access to quality healthcare services delivered in a cost-effective and compassionate manner. And as I shared earlier, we are state and federally funded, and we believe in being fiscally responsible with our taxpayer dollars. With that said, out of every dollar, about 96 cents goes directly to administer our members' healthcare benefits. Our administrative costs are very slim. It's about 4 cents out of every dollar. So we believe in being fiscally responsible and ensuring that our members or the tax dollars go directly to serve our members' access to healthcare. I'm also pleased to share that we just celebrated our 25th anniversary. We've been administering the Medi-Cal benefit to Orange County residents for 25 years. And when we look back in time, you'll see that our membership has significantly grown. In 1995, we launched the organization with 180,000 members. And to date, it's actually higher than that. This is a new statistics, but it's about 100,000 members. And we have seen an increase since the COVID pandemic. And with the economic climate, we do notice that our membership has grown significantly. I want to say in October, when we were celebrating our anniversary, it was closer to 760,000 members. And as you can see here, it's over 100,000 members. When we launched, we had one line of business, which is Medi-Cal, and we have expanded our programs to serve seniors and people with disabilities. And we've also increased our threshold languages. We started with 3 threshold languages and have expanded to 7. And I think this speaks to the diversity of Orange County as well as the diversity of our members. And we as an organization have grown as well in terms of our team here at CalOptima as well as our annual revenue. I wanted to speak a little bit in terms of our membership. So when you look at the slide on the left, you'll notice that the majority of our members are children and families. We do have a growing population of older adults. And as some of you may know, the demographics for older adults is really the only age group that is growing in Orange County, while all other age groups are decreasing. So I imagine that our membership for older adults will increase as well. And then a slide on the right talks about our threshold languages, the majority of our members speaking English, Spanish, and Vietnamese. The next slide speaks a little bit more to our true membership. I think the ethnicity speaks more accurately and reflects our membership. So about 44% identify as Latino, 18% identify as white, 13% as Vietnamese, and the other ethnicities for our threshold languages are in the single digits. Again, the majority of our members are children with families, they're adults, seniors, pregnant women, foster children, people with disabilities, and specific conditions. And so those conditions are breast and cervical cancer, end-stage renal disease, as well as now the COVID-19 diagnosis and treatment. When we look at the specific conditions, it will be based on those conditions and not necessarily the income requirements. Now you may be asking, what is the process to become a CalOptima member and where do you start? So I wanted to share a little bit about that. Anyone who is interested or curious about getting Medi-Cal must complete an application. And this can be done at Social Services Agency or one of our community partners. And it's Social Services Agency that determines the eligibility, and they have up to 45 days. And once the 45 days, when they determine the eligibility, they send that information to the state. And if they live in Orange County, they will be assigned to CalOptima. And the first step is they must select a health network and doctor within 30 days. And the final step is they must renew a Social Services Agency every year. Now with the pandemic, they are waiving that requirement to renew with SSA every year. However, I think it's important to share because oftentimes our members do not complete the renewal package, and that's when their Medi-Cal benefit will be terminated or will be discontinued. And often that will create a lag in them accessing their benefits. I do want to share that it is social services agency that determines the eligibility. Oftentimes we have members coming or individuals in the community coming to CalOptima to inquire about the eligibility or to apply, but it's actually social services agency. I also wanted to share that, sometimes going to a government entity can be rather overwhelming or intimidating. We do have community partners who have been funded by the California Endowment to do that outreach and education piece. And we have some of them listed here, including the Coalition of Orange County Community Health Centers. They have community health centers located throughout the county, and they have insurance enrollers. We also have Community Health Initiative of Orange County. Their main office is in Santa Ana. They have satellite offices throughout the county. And if for any reason you are having difficulty with your Medi-Cal benefit, perhaps SSA is missing a document or a form, I highly recommend that you connect with Community Health Initiative of Orange County, because they do provide short-term sort of case management. If for some reason your Medi-Cal benefits are discontinued, they can provide that short-term case management and provide the required documentation to Social Services Agency. People can still apply online through Covered California. And of course, Social Services Agency have their regional offices. So anyone can go to the SSA regional offices, which I understand have been recently reopened with limited capacity. However, these are places for entities to go and apply for Medi-Cal. This is just a sort of short list based on what to bring when you are applying. Again, is based on income. So of course, proof of income. And again, this is really going to vary based on the individual. So if the individual is applying based on medical diagnosis, they would have to require medical information. But this gives you an idea in terms of some of the documentation that is required. And then once they become a member, they will receive a welcome letters from CalOptima, and we will have instructions on how to select a health network as well as a doctor or PCP. We have a member handbook, and we used to mail the provider directory, which was about the size of a phone book, and we've definitely being more environmental. For that provider directory, it is online, or print copies are available if you call our customer service department. But again, similar to when you started employment, right? And when you were provided health insurance, you selected a health network and a doctor, or a medical group and a doctor. This is very similar, where you would select a health network and a doctor within that health network. With that said, these are all the health networks that CalOptima is contracted with. We are called something called a public and private partnership, which means that as a public agency, we're contracted with private health networks to administer the healthcare benefit. And when you look at the logos of these health networks, you may recognize many of them. Our members have access to 13 health networks, and many of these health networks are the same ones that are available through the private sector. And as you can see, you may notice the CalOptima Community Network on the far left. On the top left is CalOptima Community Network. And this allows doctors and specialists to contract directly with CalOptima, which has allowed us to expand our provider network. And we're contracted with over 90% of all the doctors and specialists in Orange County through our health networks. So again, I just want to reiterate, as soon as they become a member, they can select a doctor and health network, and there's various ways to do that. They can certainly search online by going to our website, and if you have a doctor that you've been working with or looking for, you can type in the doctor's name to see which health network they're assigned to. You can also call our CalOptima customer service. Our representatives are available if you are looking for a health network or a doctor to narrow down the search. So for example, if you're looking for a doctor that speaks Spanish within 5 miles of your home address, our customer service representatives can provide that search for you. So again, you can call the main number for our CalOptima offices. It's listed there as a 246-8500. We also have a satellite office in the city of Westminster, and we have the TTY number. Now, in non-COVID times, our members could come directly to our offices and meet with our customer service representatives. However, due to COVID, our offices are currently closed to the public. This is what it looks like when you come to our website. It has been newly redesigned, and we have a tab for members and different options. So if you're looking for a doctor or specialist, you can type that in, as well as behavioral health provider. If you're looking for certain specialties, there's definitely an opportunity to do the search on your own, or you can call our customer service department at the number listed. This is the form that comes with the new member package. So if you want to fill out the form, this is what the form looks like. But again, you can call customer service to make that selection as well. And if you don't choose a doctor, CalOptima will choose a doctor for you. There's an auto assignment algorithm where a doctor within 10 miles of your home address who speaks your language will be automatically assigned to you. I do want to share that we strongly believe in member choice. It's so important for the doctor to really understand your medical needs or your child's medical needs and building that rapport. So I just wanted to share that members can change their health network or doctor every 30 days if they elect. Certainly, we don't encourage changing every 30 days because it's so important to build that relationship and for your doctor to understand your medical needs. But we do believe in member choice, and we want to make sure that our members know that they can change a health network and doctor. I wanted to share a little bit about the cards that are sent to our members. Now, the Benefit Identification Card, or BIC for short, is the one that comes from the state. The one on the right, the blue and white one, that is the old card. And the one on the left are the ones that are newly issued. So I believe as of about 2 years ago, the ones on the left are the ones that are being issued in the community. Both of them are still valid. I think what they've done is they've updated the design, and they've also removed the member's social security number, which is awesome because of all of the identity theft that can take place. So again, the BIC card is what comes from the state. You can use it for vision or dental. The CalOptima ID card is the one that you're going to use for any of your healthcare benefits, including doctor's visits, pharmacy, vision, or dental. But again, these are the two cards that you will receive, the BIC card coming from the state, and then the CalOptima ID card coming from CalOptima. This gives you an example of the medical benefits that are available. This is a very, very condensed list. For a more comprehensive list, you can go to our website under the member tab and look at the member benefits. And it's a very comprehensive list. And as you may know, health benefits oftentimes do change based on the state and federal budget. However, our services are very comprehensive. And I think it's worth looking at the list of all of the benefits that are available to our members. I do want to share that vision and dental is available as a Medi-Cal benefit. The vision is provided through VSP, and really it's offered at so many optometrists except VSP. However, if you can't identify a provider, you can call the 1-800 number. Our vision benefit was recently expanded, so all of our members can get eye exams and eyeglasses every 24 months. For those diagnosed with diabetes, eye exams are available every 12 months. Now, as you may know, and I think our next presenter, Paula, will expand on this, Kaiser is a little bit different. Kaiser is everything is in-house under the same umbrella. So as I'm going through this presentation, please know that Kaiser works a little bit differently, where everything is sort of in-house, where if you're working with the other health networks, they may refer you to a doctor or specialist in different parts of the county or different cities, but Kaiser is usually all under the same umbrella. Dental services are available for our members as well. I think a lot of our members don't know that vision and dental are available. Dental is something we call a carve-out, which means that we do not administer the dental benefit. It's actually Denti-Cal that administers a dental benefit. So if you are looking for a Denti-Cal provider, I recommend that you call the 1-800 number to identify a Denti-Cal provider. And I know they've done quite a bit in the last couple of years to, number one, outreach and share information about Denti-Cal. Secondly, to enroll more Denti-Cal dentists, and they've also built in a sort of case management component. So if they are serving a member or an individual with special needs, they do have some sort of short-term case management to connect members to the dental benefits that they need. I just wanted to share that, once our members become CalOptima, we do recommend that our members schedule a visit with a new doctor within 3 months of joining CalOptima. And this may seem obvious to many of you. However, we do have individuals in the community that may have never had a medical home, or perhaps they've gone to the community clinic and have seen different doctors at different times, or they've always accessed the emergency room for medical services. And so I just want to share that, that there may be individuals who have never really been a part of this sort of a medical home or the system. So we do recommend that our members, upon joining, go visit their new doctor within 3 months, and the doctor will diagnose injuries and illnesses. They can refer you to a specialist, order prescriptions, complete routine exams, and transfer medical records. And again, I just want to emphasize that everything starts with a PCP, or doctor for short. They will also refer you to a specialist for medical services and referrals. And again, I talk about the health network, and what happens is when the doctor submits the referral, it's your health network that is going to process the referral, and it takes about 5 business days to process a referral, and urgent referrals can be decided within 72 hours. So for some of you, if you've ever had the experience of, going to the doctors and then being referred to a specialist, and it's been like 3 or 4 or 5 weeks and you haven't heard, that might prompt you to call the doctor to find out the status of the referral, or even call CalOptima to find out the status. Because again, I think it's just important to know what are the timelines, and also to kind of to share this information with you.
Tiffany, there is a question from the audience, and it's about fees. For the dental or vision care, are there any fees?
If you have full scope Medi-Cal, there should be no fees tied to it. And so when I talk about full scope, some of you may have something called share of cost, and there's a slide related to share of cost, and that is determined by social services agency. For full scope Medi-Cal, you should have no copays for your, for your medical services. Sometimes, what will happen is you're allotted a certain amount for vision or for dental. Sometimes those practitioners may want to upsell something. Maybe you have a certain amount allotted for glasses, but you want these other name brand glasses, which costs $100 more. So in those cases, there's only a certain amount that can be covered. And then dental is the same. Like, for example, if you're going to get, and we can't really speak on behalf of Denti-Cal, but sometimes dentists will say, well, do you want the porcelain filling instead of this other filling? So if they're upselling it, then, sometimes our members will be like, yes, I want this other one, but it's not covered by Medi-Cal. And I think that's where it gets a little gray. So certainly you want to ask, well, what does Medi-Cal cover? So you have an idea in your head exactly how much you can spend. If they want to upsell it, that's where I think it gets really tricky. If they want to say, oh, do you want this other one? Then that's where there might be fees tied to it, but there shouldn't be any fees.
Thanks a lot, Tiffany.
Sure. I also wanted to share about prescriptions. So our, prescriptions is a Medi-Cal covered benefit, and you'll just show your CalOptima ID card. And again, for full scope Medi-Cal, you should have no copay or out-of-pocket costs. There is a caveat to that because we do have members who have Medicare and Medi-Cal. And so for those members who have Medicare Part D, there may be a share of cost for the prescriptions. But if you have full scope Medi-Cal, there should be no out-of-pocket expenses for prescriptions or even doctor's visits where, like for myself, if I go to the doctor, I have a copay when I go see my doctor, or if I fill a prescription. We also have a formulary. So similar to your health plan, all health plans sort of have a formulary of all the medications that are covered. We have a list of all the formularies that are covered on our website as well. and there's a limit of 6 prescriptions per month. However, you or your doctor can request an exemption, and it's really based on medical need. We're also contracted with all the large chain pharmacies except for Costco because they're special. But again, we're contracted with nearly all of the large chain pharmacies in Orange County. Medical supplies and equipment, as well as custom wheelchair benefits. These are both Medi-Cal covered benefits. And again, what you'll see here is a common theme, which is the doctor or the PCP is the one who is going to write a prescription indicating there's medical necessity, and it's the health network that will process the prescription. Wanted to share a little bit about urgent and emergency care services. Because we are state and federally funded, we believe in being fiscally responsible as well. And so I wanted to share that urgent care services are available. We do have members, CalOptima members, who are working 2 to 3 jobs, and perhaps, they're not able to go to the doctors during traditional hours. We are contracted with urgent care services, so they just need to call their health network to find out which urgent care is contracted with their health network. And emergency room services, again, are really designed for life-threatening serious illnesses. Our members can call 911 or go to the nearest hospital. And they just have to show their CalOptima ID card. Wanted to share a little bit about transportation because that is also a covered benefit through Medi-Cal. There's 3 different types of transportation that is covered, and I know the words and the acronyms we have get rather confusing. So I like to think of it as the way that transportation is delivered. So for example, emergency transportation. It is the ambulance in an emergency situation when you call 911. It's the ambulance services that are covered. Paramedic services are not covered, and that is something that can be arranged through the City Hall for paramedic services. However, ambulance services are covered. We also have non-emergency medical transportation. So again, it's not an emergency, but it's medical transportation. And this is designed for our members who may have a medical or physical disability where they're unable to use traditional transportation. So for those members who need NEMT, is non-emergency, but it's medical transportation, we offer it through ambulance, litter van, or wheelchair van. So I think of the ambulance in a situation where perhaps a member is receiving medication and they need to be monitored. So they need to be monitored and supervised from their home setting to their doctor's visit, and it would be transportation through an ambulance. A litter van is an example of someone who perhaps cannot sit upright. So they need to be transported in a gurney from their home setting to their doctor's visit in a litter van. A wheelchair van may be for someone who's paraplegic and perhaps they can't use traditional transportation. Maybe it's someone who has severe mental confusion and perhaps they need to be in a wheelchair being transported from their home to their medical setting. That is non-emergency transportation. And the newest benefit, the newly expanded benefit, is non-medical transportation, which again, non-medical and is transportation. So before I get into that, I do want to share about the process for non-emergency medical transportation for our members who may have a medical or physical disability that they're not able to use traditional transportation. And it's very simple. It needs to be requested by the doctor. It needs to be medically necessary when a member cannot use a car, bus, taxi to get to their appointment, and it just needs to be approved by the health network. The doctor is going to submit an NEMT request, and they will submit a physician certification statement form that is sent to the health network for approval. Now, the non-medical transportation is a newly expanded benefit, and I don't know if it still counts as new. It's been about 3 years now, but essentially it's designed for our members to access their Medi-Cal benefits. We have members who may be taking 2 to 3 buses to get to their doctor's appointments or to fill a prescription, and we recognize that transportation is a barrier. NEMT, or non-medical transportation, is designed to increase our members' access to their healthcare benefits, and it's available via taxi, bus, or private driver. For any Medi-Cal covered benefit, it's available round trip, and it's unlimited. So again, it's based on the need to access your medical benefits. And it's really simple. We have a transportation line that's available 7 days a week, 8 a.m. to 8 p.m. When calling, our member would provide their ID number, and the representative would determine if it's a taxi, bus, or private driver. And we do encourage our members to call at least 2 days in advance to schedule the appointment. And we do have limit urgent same-day transportation. Wanted to talk a little bit about financial responsibility. Again, paramedic services are not covered. I touched a little bit on share of cost, and this is something that is determined by social services agency. And so this is for our members who may be on the lower to middle income. And essentially what happens is when you're applying for Medi-Cal, SSA or social services agency may say that you have a share of cost. And it's similar to a deductible, where they say that, let's say a family has a share of cost of $100. So when they go to access their medical benefits, they will pay that $100 for that month. And after that $100 is paid, the remainder of their medical benefits are at no cost, but that share of cost will reset every month. And so that is something, again, determined by social services agency. And then we do have members who have private insurance. So they may have private insurance as their primary or first insurance, and then CalOptima Medi-Cal as their secondary insurance. So again, because we are state and federally funded, we are the payer of last resort. So your healthcare provider is going to bill your private insurance before billing the Medi-Cal covered services. And if you feel like you were billed for a service that is inaccurate, you can contact the biller to make like your doctor's office or the biller to remind them that you have the Medi-Cal health insurance and ask them to bill a Medi-Cal. And if the biller cannot help, you can contact your health network or CalOptima's customer service to help resolve that bill. I want to share a little bit about our support services. I feel like this is definitely something our members or the community at large are not aware of, is that we do have a lot of support services available to our members. Our frontline workers are our customer service who can answer members' questions about any programs or service or the Medi-Cal benefits. They also handle grievance and appeals. So a grievance is when a member has a negative experience, whether it's with the transportation or the doctor's office, but they are filing a grievance, which means that they had a negative experience. And we have a formal process to review all grievance and to research that. And to be very honest, I think in community relations, it's helpful for us to know because we're not able to address a situation if we're not aware of it. An appeal is when, for example, maybe a member or a doctor is requesting to see a specialist. And so when they sent the referral, perhaps it was denied. And so the member and the doctor have the opportunity to appeal that denial and for a second opinion. And so we also have a formal process for appeals, which means that, I don't agree with the declining the service. And so I would like to appeal the decision and get a second opinion. And again, we have a formal process for that. Our customer service also can help our members change their doctors for the CalOptima Community Network or change their health network or assist with coordination and access of services. And our frontline workers, their goal is to address the member's question or concern within the first call. And there are several tiers within customer service with the frontline workers and supervisors and managers to support our members' access to care. We also have a member liaison program to help seniors, people with disabilities and chronic conditions, or members without housing. So if any of these groups are having difficulty with coordinating their transportation, or perhaps following up with a specialist, they can certainly call and request the member liaison, who is assigned sort of on a short-term basis, but it's really designed to help our members if they're experiencing challenges with accessing their health care. And then whole child model is something that's still fairly new. I think we just celebrated it's been a year and a half, and it's designed to serve children and individuals who are part of California Children's Services to support care coordination. And so even though it's been about a year and a half or 2 years, it's still a lot of information that needs to be shared in the community. What we learned is that of the 14,000 children who are on CCS, about 13,000 of those children had Medi-Cal. And so for a lot of the families who had private insurance, CCS and Medi-Cal, it became very difficult for those families to sort of coordinate their child's medical services. And so the idea behind whole child model was that, CCS would still determine eligibility in the medical therapy unit, but that CalOptima, given that the majority of these children had CalOptima and were on CCS, that we would coordinate their medical services so it was more streamlined. And one of the benefits of the whole child model is that there is a personal care coordinator who is assigned to the families who can support, provides a health needs assessment, and help support with doctors, following up with a specialist, arranging transportation and whatnot. So this is still a fairly new program in the community. We also have a very robust case management department, including nurses, social workers, who are there to support our members to learn about their health conditions and connect our members with community resources. They can communicate with the healthcare team and even develop a plan to meet our members' health goals. And we have a long-term support services as well, really designed to keep our older adults safely in the community and out of skilled nursing facilities. We have programs such as the community-based adult services, multi-purpose senior services center, as well as hospice and palliative care. And in non-COVID times, it was very interesting because a lot has changed. We've adjusted or pivoted our services to provide in-home services. However, we're slowly transitioning to in-center services. But again, we want to make sure that it's a safe environment for our older adults. We also have interpreter and translation services. So our members have access to interpreter and translation at no cost. We have written materials for our medical line of business in the 7 threshold languages, as well as large print or braille. And interpreter support is available in person or by the phone. Our members just need to call the doctor's office. Actually, they just need to call the health network or our CalOptima customer service a week in advance to coordinate the interpreter services for their doctor's appointments. And then we have health management. It's no cost face-to-face and telephonic coaching, community classes, and mailed information. And these are some of the topics that our health management department can help with. So for more information, you can call that number that's listed on the slide for additional support with our health coaches, nutrition specialists, and more. We also have a health rewards program, and that is really designed to support our members with accessing their health care. What we know is that we do have members who may be late or missing some of their screenings, diabetic exams, postpartum checkups, tobacco cessation, as well as weight loss. So we have designed programs specifically to encourage our members to access these benefits. And when they do, they receive an incentive, usually in the form of a $25 to $50 gift card for accessing their healthcare benefits. So it's really a win-win for our members as well as for CalOptima. Our goal is to make sure that our members access their healthcare benefits and our members are incentivized for following routine checkups and exams. If you would like to learn more, you can call the health management department listed on the slide here. And I believe Judy did send a PDF of this PowerPoint presentation, so all of the information will be available to you. I wanted to share a little bit about our behavioral health benefits because this is also one of our Medi-Cal covered benefits. And we do provide outpatient psychotherapy for Medi-Cal as well as One Care, One Care Connect. And One Care, One Care Connect is a program for individuals who have Medicare and Medi-Cal. We also provide psychological testing, medication management, behavioral health treatment, psychiatric inpatient, and then partial hospitalization. And then as you can see here, you'll see which benefit is covered by which plan. A little bit about our behavioral health services. Again, outpatient psychotherapy. This is the individual, family, and group therapy. Medication management, where our psychiatrists may prescribe medication for behavioral health treatment, for diagnosis such as attention deficit hyperactivity disorder, depression, anxiety, and others. We also provide psychological testing to assess behavior for impairments, as well as ABA therapy to help members with behavioral challenges. It's interesting because when we assumed, or CalOptima as an organization, when we assumed ownership over delivering or providing the behavioral health treatment services, it allowed us to have more sort of information and control, as well as being able to connect our members to behavioral health services. I do want to just share that this is really based on medical necessity and the doctor really providing the information in terms of the diagnosis that often, well, I think it's fair to say, that will drive the services or the treatment plan. For ABA, I just also wanted to share it's designed for members under 21 years of age. And then a little bit about impairment level and level of care. For mild, our members can access or even get the diagnosis or from the primary care physician. Mild to moderate, we do have the CalOptima behavioral health providers. And the next slide, I'll share a little bit more how you can access that. Now, for moderate to severe, those services are delivered through Orange County Mental Health Plan. So we have a very close relationship with Orange County Behavioral Health, where if our members are in the mild to moderate and we're seeing that they may need a higher level of care, we warm line transfer them to Orange County Behavioral Health. And of course, it's very fluid and it's dependent on the member's needs. So accessing behavioral health services, it's a toll-free number that our members can call 7 days a week. And when they call, there's the behavioral health line where our representatives will do, number one, check their Medi-Cal eligibility. Secondly, provide a quick screening to ensure that it's mild to moderate. And then they'll provide our member with the phone numbers for about 3 behavioral health providers to start and access the behavioral health services. Now, with that said, I just wanted to share that our customer service representatives can help support that first appointment, because we know how sometimes that can be rather tricky, right? Sometimes you're making the phone calls and you don't get a call back. So our members can request support with scheduling that first appointment. I did want to share a little bit in terms of diagnosis for autism spectrum disorder. In the past, a full developmental diagnosis evaluation was required. However, we do have an updated APL or all plan letter, which indicates that, that a full developmental diagnostic evaluation is not necessarily required, although our members can access that by calling our behavioral health line. We do need documentation from a licensed provider, such as a physician or psychologist with a diagnosis, with an aid code or a diagnosis, and also indicating the therapy or the treatment services, and that will be suffice as well. So that is probably one of the more recent changes. Now, with that said, our members, if they want to access the behavioral health services for an evaluation, they can call this 1-855 phone number as well. I also want to share, we do have a satellite office in the city of Westminster, and the idea is to serve our members in their community. And this slide shares a little bit about our redesigned website, making it easy for our members to access, learn about CalOptima and Medi-Cal. We created a secure online member portal, so members have more control over their health care, and where they're able to update their personal information, request a new ID card, print a copy of their ID card, change their health network or doctor, and access the member health network as well as the health network provider directory. And this slide just shares how really comprehensive our services available to our members. And really in the center of it is to be able to support our members' access to healthcare. And I think the one thing that I've learned in community relations is we do have a lot of services as well as support services for our members, but if they're not aware of what's available, or if they don't know who to call, then certainly they're not maximizing the benefits that are available to them. And so in closing, I just want to share that these are some of the main phone numbers that will be helpful to you. Now, if you have any questions about CalOptima or Medi-Cal, our customer service line is available to answer those questions. We talked a little bit about the behavioral health. So here's the phone number you can call. You can also connect with your doctor or psychologist if you're looking, you have a relationship with a licensed provider who can provide that diagnosis. We will accept that as well. We also have a new nurse advice line that's available for all of our members. So if it's 6 o'clock in the evening, and you're not sure if you need to go to the doctor, or if there's anything you can do at home, our nurse advice line is available to really just get information and really guide our members on next steps. We also have our population health management department, and it's available to support our members with addressing any chronic healthcare needs, health education and resources. Alrighty, and then also other agencies I think it's really helpful to know is we have the county's behavioral access line, Orange County Social Services Agency, who determines the eligibility, VSP for vision, and then Denti-Cal for dental services. All righty. So with that, that concludes my presentation.
Okay.
But I'm Dr. Paula Pompa-Craven. I'm the Chief Clinical Officer and a licensed psychologist at Easterseals Southern California. And what I was trying to say is I've been with Easterseals for 26 plus years. And one of the things that I did at Easterseals during my dissertation was looking at self-determination. So it was interesting to hear about the training you have coming up. And it's hard to believe that it's been, over 20 years and they still haven't truly launched self-determination within the DDS system. So hopefully some people will find it useful. I'm going to talk a little bit today about Easterseals, who we are, and how we're connected to Kaiser Permanente and our insurance offerings for individuals with autism and their families. So a little bit about Easterseals, about the insurance mandate, our services, kind of how to navigate through insurance services at Kaiser, and a little bit about service disparity, because I think that's really important to talk about, and kind of what we're trying to do to assist to bridge the gap in services, what to expect if you do receive a referral, and then some contact information. So our mission at Easterseals is to change the way the world defines and views disability by making profound positive differences in people's lives every day. We are a non-profit service agency, and we really provide services and supports across the lifespan. So on the next slide, you'll see our services include our autism therapy, which I'll talk a little bit about in a minute and go into detail, our adult day services. So we serve about 1,600 participants. These are regional center funded services and really working toward building their daily living, social, and work skills. We also have child development centers throughout Southern California, which include preschools, state daycares, health, and we do nutrition and family home-based support, early intervention, early Head Start and Head Start programs as well. Our living options are also throughout Southern California, and those include supported living services, independent living services, as well as residential, which are small community homes, specifically targeted at moving people from developmental centers or more congregate types of situations to a smaller living arrangement. And then we also have our Work First and Bob Hope Veteran Support Program, where we assist individuals with job placement, job support, and other types of customized employment services. This is a photo of our office, and I put this in here because I wanted you to see, I know you're from Orange County, and I wanted you to see that our corporate headquarters was relocated to this building right off the 55 freeway. You could probably see it as you drive by. We're very proud of it. Our Easterseals headquarters that houses all of our administrative offices and supports, as well as a therapy center for Autism Services, which I'll talk a little bit more about. Our Autism Services program serves about 13,000 participants every day. We have about 1,400 staff members. I'm sorry, that was Easterseals. Oh, this was a duplicate. If you can go on to the next slide, please. Our Autism Therapy Services serves about 11,000 people annually. We have over 1,000 staff members. You can see to the right there, the California areas within Southern California that we serve. We have 15 locations where we provide we have therapy centers, but we have about 40 locations overall in within the 7 California counties, from Kern in the north all the way down to San Diego in the south. Our main insurance that we work with is Kaiser Permanente, and we had started a partnership with them probably, well, it's been almost 9 years now when the insurance mandate came through, which I'll talk about in a minute, but we became their main referral source for all of their services for individuals with autism throughout Southern California. And when we can't support a family or an individual directly, if we have a wait or we don't have capacity, we have over 100 network providers that include behavior service providers, speech, OT, and PT providers throughout all of Southern California that we contract with. So if we can't serve somebody, we work directly with them, and we provide the information and the referral and the case management, all of the billing, so that it is hopefully a seamless experience for families who come to us through Kaiser. A little bit about our services. I'm not going to go through this because I'm worried that it's going to mess things up, but it will be available to you. Yeah, that last slide was a bit funky, but it really talked about the insurance mandate, and I do want to talk about this. Hopefully most of you are familiar with it. SB 946 was enacted in 2011 and became effective in 2012. And really it covered small group, large group, and individual plans for individuals with autism, and provided behavioral health treatment. And for purposes of that law, behavioral health treatment was known as professional service and treatment programs, including ABA and other evidence-based behavior intervention programs, to develop, restore, to the maximum extent possible, the abilities and really to assist people who had ASD. And so the treatment had to be prescribed by a licensed physician and be provided by a qualified autism service provider. There's no cap on this coverage in the state of California, which is different than what we see in some states. So the insurance services that are covered by Easterseals through our partnership with Kaiser Permanente, and one of the reasons that Kaiser came to us for this partnership was because of mission alignment. We're both nonprofits. As the previous guest had mentioned, Kaiser provides all of their services in-house, and this was one service that they had not been providing, and they really wanted to have one vendor that could coordinate the service and provide the service. So it really felt like an arm of Kaiser that you were going to, as if you were going in for any types of medical services or any dental or whatever services you might need there. This would be just be an extension of those types of services. And so specifically for their members with autism, they contracted with us for speech, occupational therapy, physical therapy, ABA, social skills groups, caregiver consultation, or parent consultation. Recently, we started to provide coordinated life services, which look more like those wraparound intensive case management services, as well as services for individuals with severe behaviors, which I'll talk a little bit about in a minute. So a little bit about service disparity, because I think that this is really important and something that we've been seeing a lot, especially during this time of COVID, that really autism, as I'm sure we all know, everyone on this call is well aware, is prevalent across all racial, ethnic, and socioeconomic groups. However, what we see is that minority groups are less likely than their white counterparts to be diagnosed with autism or as having a speech delay. And African American and Black children with ASD are less likely to have their first evaluation by age 36 months, which we know is really important. The earlier the diagnosis and treatment, the better. Usually they're lagging at about 15 months behind. Some of the barriers that are reported by African American, Black, Latinx families include just a lack of understanding of the medical system, a lack of insurance, not having their child receive a diagnosis, limited access to healthcare, and feeling like the doctors maybe just don't understand what they're going through. The disparities also range across just general access to health insurance, as well as regional center funding. So what we found in our review was that the funding was disproportionate to people who were of color, lower income communities than they were to other ethnic groups. And so what we're doing at Easterseals is we're really trying to get out and connect families with services and to get into communities of color and even to provide some level of access and diagnostic testing for those who are on very long wait lists or who really just don't know where to go next. And so that's one of our main goals at Easterseals as we move into toward the end of COVID, especially. Next slide, please. So a little bit about navigating insurance at Kaiser. So one of the main things that you want to do is to talk to your pediatrician or to your doctor. Insurance that are funded through your typical HMO plan through Kaiser commercial insurance are not limited to under 21. So we are able to work with adults. And we have been able to do so pretty successfully, especially around in areas where we're looking at building skills and increasing communication and really decreasing any kinds of health and safety issues. If for children especially, we want to always ask for a developmental screening referral or a behavioral health referral. And then at the end of this presentation, I'll have the member services information for you in Orange County that you can call to get more information as well. So what happens after referral? So the doctor sees you, you go through, you get screened for ASD, or you already have ASD, and they give you a referral for let's say ABA, speech, OT, social skills services. So the next thing that happens specifically within Orange County when it comes to speech, OT, PT, is that you'll get your assessment and evaluation directly through Kaiser. They'll send you to us with a treatment, preliminary treatment planning goals in place. If you're coming to us for an ABA or social skills assessment, we will take about 4 weeks or so to go through and meet with you and meet with your families. And if it's a child, we'll meet with the child as well. We go through a series of standardized assessments, behavior assessments. We really want to try to find out, what are some of the challenges that you may be having, what are your goals for treatment, and then work to develop a treatment plan. This takes about 4 to 8 weeks, but there's a licensed BC or certified BC board certified behavior analyst working with you throughout this process and explaining the process, as well as working on to develop treatment goals to move forward. We also do a lot of indirect and direct interviewing, as well as looking at record reviews, if there's any school information, medical information, as well as direct testing. We use verbal behavior assessment, as well as the Vineland adaptive assessment and other tools to really kind of see what the current level of functioning is, as well as, where are we trying to go? What goals are we trying to reach? One thing that we do that I did want to mention is that Medi-Cal, our medical versus educational programming is an area that we look at. These services are pretty specific to medical necessity. So because they're funded through health insurance, in speech OT PT, we're looking at functional communication skills, daily living, physical mobility. In ABA, we're looking at again, functional skills, communication, health and safety. So we aren't necessarily working on educational skills. We kind of leave that to the schools, but we will work with the schools, especially if there is some sort of challenge that is keeping or preventing someone from being successful within school. Very good example of this is, we had a lot of kids who were on telehealth for school, and they were having a hard time sitting in their seats and attending and kind of working through this new way of doing things. And so we spent a lot of time working with families on strategies to make that happen. Next slide. So our speech OT and PT programs typically take place in our centers throughout Southern California, but with COVID, we moved to our telehealth offering. And when we started, we were seeing about 80% of our families over telehealth. We're now down to about 65% via telehealth, 35% in the center. And what we found is was a really good opportunity for a lot of our speech therapists and our occupational therapists to see the home environment, because typically the participant would come in to the center and receive services there. And so this was a way for us to see, let's say we were working on something like eating or teeth brushing, or we could actually see what the bathroom looks like and how it's set up, so that as we work with the OT on how to hold a toothbrush and how to take those steps to brush your teeth, all of those things can be done in the natural environment, which was very nice for our therapist. We also, all of our centers have occupational therapy gyms. Many of them have therapy kitchens, because we do work on a lot of feeding issues with the people that we support. And as I had mentioned with telehealth, almost all of the insurance companies that we work with have approved telehealth coverage as a form of service. And I imagine that they will continue to do so, because we have shown pretty successful outcomes. Next slide. So ABA takes place in the home environment typically. So what we call the natural environment. And so wherever your child would naturally be, or wherever you would naturally be, so your home, your backyard, the park, living room, etc. You know, we may go, especially if we have kids are having a hard time going to the dentist or to the doctor or to a store, we may accompany the family in that area to provide that added support and to work to build skills so that we could work toward a little smoother transition into those types of settings. And then we always look for teachable moments throughout our daily routines. And so we ask, you know, a lot, there's a lot of dialogue going on, and we really work toward finding out what the best way to communicate for each individual child may be. And we really work to develop our treatment plans specific to the individual needs of each participant that we serve. Next one. So what are the ABA sessions? So how often we have typically 1 to 7 days per week that we see kids, anywhere from, you know, 8 hours a week to some that are at 40. Sometimes we have 2 sessions a day, and they can range from 2 to 4 hours. We do our best to schedule within the availability of the family. It's definitely one-to-one teaching. A lot of it looks like play, but it's very strategic in our approach. It's led by a treatment plan and by a board certified behavior analyst, and it's very data driven. So we're always collecting, we're looking, we're modifying, we're changing based on what the evidence is showing us. And we're really always looking at the motivation of the participant and trying to, you know, really encourage and support and strengthen their motivation to do more. And then speech and OT and PT. For speech, we're really looking at overall communication in the modality that best fits the individual. So is it verbal? Is it sign language? Is it a picture exchange system? With OTs, it's really about maximizing those everyday skills, like lifelong skills, brushing your teeth, bathing, dressing, you know, including, you know, tying your shoes, etc. And then a lot around food and picky eater syndrome that we work toward. And then for physical therapy, those services are a little more limited. They aren't as authorized as often with our participants, but we really look at increasing strength and mobility to navigate a person's environment. So with the babies, we see, you know, the little ones, we're really focusing on crawling and walking and kind of that balance and that gait. Next one. Social skills groups. So for our participants who maybe have gone through our ABA services one-to-one, or really just are focused on a social skill building, we do have groups within all of our centers. They are Zoom based right now. They were in person. They're 1.5 hour sessions, sometimes 1 to 2 times a week. They're very small groups, like eight participants maximum. They're based on building skills, friendships through games and activities and social, you know, developing social situations. They're led and facilitated at a 1 to 4 ratio. So typically there's 2 staff for every 8 kids. And a couple of the cool things that we're doing in the Orange County area specifically is we have a partnership with the Segerstrom Center for music therapy within the social skills group. So, you know, the bottom picture there, you can see they're drumming on the drum, and then they'll have a discussion, and there's a whole curriculum around specific to, you know, taking turns, or you know, maybe just tolerating the sound of the drum, or whatever it might be that the kids are working on together as a group. And then the other thing that we're doing is some VR research, virtual reality research around safety. There's a lot of work around safety. What do you do? Community safety. What do you do when this happens? And so this is a way to actually help the kids to be in that environment without physically putting them in that environment. So how do you approach a police officer if you need help, or if there's a dangerous situation, or if you need to cross the street? So how do we do this within that type of environment? And a lot of the group members are very excited because they love gaming and they love VR anyway. So this is a nice way to kind of add that to their social skills groups. And then our severe behavior services are designed to provide services to meet the needs of individuals who show self-injurious behaviors, danger to self or others. And if any of you have ever experienced this, what we know about Southern California is there really aren't any providers who provide this type of services unless you put someone in a hospital or an acute setting that really isn't specialized and doesn't really work well with our population. And so a lot of families are sending their a lot of times it's teens and young adults to other parts of the country because they have this type of specialized services. So we recently in the last year acquired an organization called Center for Behavior Sciences, and Dr. Joyce Tu and Dr. Shaji Hawk are both very experienced in this area. And so they've helped us to start to generate this service offering to our families. This is for those kids who aren't successful in school, who are getting kicked out, who are hurting themselves, hurting their families. And we really are trying to find a way to figure out what the function of their behavior is and find treatment for that behavior and work toward that. And so, we have a lot of safety measures in place with the physical environment. This happens in a center, so we can kind of remove all of the elements around what is going on in the home. And then there's usually a 2-to-1 staffing ratio, and all the staff are very well trained and very well equipped with what they need. Most of the time, these are half or full day programs. And our whole goal is really to get to the point where we can help the person return to services in their home in a more natural environment so they can go back to school and kind of go on with their daily living. These services are currently provided in Irvine. And so we have about 10 to 15 individuals that we're working with now, but we're really hoping to expand in this area in the coming year. And then other offerings I just want to share with you. We're really excited because we're probably one of the only autism service organizations of a very limited few that offer a research department. We have our own IRB, our Institutional Review Board, that reviews all of our research proposals. We have research around outcomes and telehealth and retention, and a lot of best practice in service delivery. We publish, we speak at conferences. So we work hard to really show that what we're doing is working, and also to influence the field to show that, how important natural environment, play-based therapy, keeping a qualified staff, training staff, all of those things are to our services. We also offer trainings to families, obviously to our staff. Some of the recent trainings we offered was fire safety and fire prevention around the holidays. We did one, a webinar there. We're doing some research around how to assist participants to exit in a fire. We also do a lot of community presentations. I recently did one for the LA Zoo, and we do presentations across Southern California as well. Prior to COVID, and now we're doing these virtually, but eventually they will go back to in-person. We had family game nights, SIB shops, and caregiver support groups that all happened at once. So you would come into our center in Irvine, and the kids would go to one room and they would play games, and that would be facilitated, and then the siblings would go to another room, and we have people who can facilitate a sibling shop, which is assistance to people who have a sibling with ASD, to just talk about kind of how they're feeling about it and any strategies they may need for support, and then also a parent or a caregiver support group happening simultaneously. So those typically happen about once a quarter, sometimes in the summer months a little more often, but everyone loves those, and they're usually really well attended. And then we also have many events at Easterseals. We have a Strides Walk. We have a film challenge. If you haven't seen that, please go online and Google Easterseals Disability Film Challenge. There's some great films. People are given basically a weekend to create a film, and there's all kinds of topics and just some really, really great films that get published each year. And then we do entertainment awards, really looking at those who provide inclusive services within the entertainment industry and hire actors with disabilities. And so we award and we celebrate those entities on an annual basis. Easterseals sponsors that as well. And then I always like to close with the mission moment, because I think it's important. I can talk to you about, the things that we do, but it's really important to hear from a parent about how their life has been impacted. So this was a parent from a graduating ABA participant who tearfully shared the following thoughts about her family's experience with us. She mentioned she was hesitant to seek out and begin services for her child. Her child was heavily averse to peer interactions, would avoid going to school, and had not made a single friend up to this point. When we began services, we noticed small changes and began to see the beginning of social innovation. Now, as we prepare for ABA graduation, he has started reaching out to children during church services and is excited about social interaction at school. Mom mentioned how this would not be possible without his therapist. She mentioned that the therapist not only helped the participant, but also helped his younger siblings and an older brother also on the spectrum, and taught the parents to confidently deliver ABA strategies. Mom mentioned she is no longer hesitant to share about her personal story, and she now understands the power of our field. From Mom, thank you very much to all our staff members for the tremendous job you put forth every day. Never forget how important you are and the impact you have on our lives. Thank you. More information, there's contact information for both Kaiser Permanente and Easterseals Southern California there.